Greetings and welcome to this conference hosted by MS Focus, the Multiple Sclerosis Foundation. I'm your host, Chris Payne, editor for MS Focus, and I'm joined today by Dr. Herb Karpatkin, who will present Ask the Physical Therapist. After a short introduction by Dr. Karpatkin, we'll open it up for your questions and comments. Now I'm delighted to introduce our speaker. Dr. Herb Karpatkin received his master's degree in physical therapy from Boston University and a doctorate in neurology from Rocky Mountain University. He is board certified in neurology and geriatrics clinical through the American Physical Therapy Association and is a certified multiple sclerosis clinical specialist through the Consortium of Multiple Sclerosis Centers. In addition to continuing to be actively involved in patient care, he is a tenured associate professor of physical therapy at Hunter College, City University of New York, teaching courses in neurologic evaluation and intervention, psychosocial aspects of healthcare, and research design. We're pleased to have him join us. And Dr. Karpatkin, thank you for being with us. I'll turn it over to you.
Thank you. It's a great privilege to be here. I'm very glad to have the opportunity to answer questions on physical therapy for persons with multiple sclerosis. And I want to thank the Multiple Sclerosis Foundation for giving me the opportunity to do this. As Mr. Payne already said, I have been working as a multiple sclerosis physical therapist for well over 30 years now. And I still see MS patients regularly. I actually saw one just this morning, and it is really the cornerstone of my career. I feel that physical therapy and exercise is one of the more underused things that people with MS can take advantage of. So I'm hoping as a result of the questions you ask me, I can motivate some of you to get more involved in exercise and physical therapy. So I'm ready to take questions now.
All right, we have our first question from Elizabeth. I have attempted multiple methods of stretching to include gentle prolonged stretches, and all exacerbate my spasticity. Any suggestions? Thank you.
Well, without knowing how spastic you are, it's difficult to say, but since spasticity is a response to a stretch of a muscle, then it is often the case that people with MS have some worsening of their spasticity, sometimes with stretching. My first approach to a patient like this would be not just stretching gently, but really stretching very, very slowly. So go into the lengthened range of the muscle very, very slowly and only a very small portion of the range. Additionally, cooling the muscle off sometimes helps a great deal. Rather than stretching right away, making sure the limb is not too warm before you start the stretching could help. But generally, when there's spasticity, that almost always means that the stretch is either too strong or held too long, or the person got into the stretched position too quickly.
All right, our next question is anonymous. I may end up butchering this, so please bear with me. How common is Piriformis syndrome in people with MS, and how is it treated?
So Piriformis syndrome refers to a tightness and related inflammation to a muscle in the buttocks. And it is not uncommon, but it is not directly due to the MS, but usually due to some type of walking or stretching asymmetry that occurs in the person with MS. And it is really more of a orthopedic problem than a neurologic problem. My first question would be, how are you sure that you have piriformis syndrome? Because many things can result in similar signs and symptoms. If it is truly piriformis syndrome and refers to a tightness of the piriformis muscle, a very simple piriformis stretch that I encourage people to try is lie down on your back, bend both your knees, and then on the side of your body that you're feeling the piriformis syndrome, cross that leg over the other so that the ankle of the painful leg is balanced on the knee of the non-painful leg. And then let that knee sort of drop down a little bit to the floor. You should be feeling a stretch in your buttocks when you do this. But again, without being sure whether you actually have piriformis syndrome, it's hard to say that this will be the right stretch or not. If you do feel like you're getting a stretch in the buttocks when doing that stretch, then it is likely that you do have some type of tightness or inflammation in your piriformis.
Let me take this opportunity to let everybody know that if you have a question or comment, you can ask it using the Q&A button in the app, which also allows you to send your question anonymously if you so choose. Or you can ask your question live by raising your hand. To do so, click the raise hand button or press *9 if you're on the phone. I will call on you and then you'll be able to unmute to ask your question. And our next question comes from Mary. I have been diagnosed, okay, Mary's been diagnosed with piriformis syndrome, which my neurologist says is due to circumduction of the right leg. Any ideas for exercise to combat and manage this painful problem?
The circumduction could certainly make the piriformis worse. Circumduction refers to a type of gait compensation that some people with MS have, where instead of stepping forward with their leg, they swing the leg out to the side and swing around. It moves in a circular motion, so it's called circumduction. I'm sorry, let me see if can we pull up that question again so I could see it more carefully?
Yeah, I've been diagnosed with piriformis syndrome, which my neurologist says is due to circumduction of the right leg. Any ideas for exercise to combat and manage this painful problem?
Right. Well, so if it is due to the circumduction, then you should be trying to find a way to walk where circumduction is not being done. And this is a pretty common thing that I see with my patients, that they've adopted some type of gait deviation as a result of their MS. Usually circumduction is done because they have trouble clearing the floor and their foot scuffs. So the circumduction is a way of making sure their foot doesn't catch on the floor. If you are circumducting because your foot is dragging across the floor, the first thing you should be trying is to find an exercise that prevents the circumduction. And my guess would be is that because you have a foot drop due to tightness in the calf muscles and weakness in the muscles of your anterior tibialis, or the muscles that raise the front of the foot. So one of the first things I would consider would be stretching out that calf muscle as much as possible and trying to walk rather than swinging your leg out to the side, trying to pull your toes up as you walk through.
We have a question from Terry from Facebook. She asks, what is the best one exercise for foot drop?
Well, like so many other questions, it depends. It depends on what's causing the foot drop. Usually, it's a combination, as I just said, of tightness of the muscles of the calf, muscles called the gastrocnemius and the soleus, and weakness in the muscles of the shin, muscles called the tibialis anterior. In the vast majority of patients with MS who I've seen who have foot drop, they have tightness of the calf muscle and weakness of the muscles on the front of the shin. So the best exercise is to really stretch out that calf muscle. Do it slowly, do it gently, and do it a lot. Most people don't stretch for a long enough period of time. 30 or 60 seconds a day is usually not enough. It usually takes several minutes to get the muscle tissue to lengthen so that the muscle loosens up.
We have a question from Anonymous. How can you identify if you have piriformis?
Well, the usual sign is that if, as you do the exercise, the test that I did before, where you lie down on your back, bend one leg, and place the shin of the painful leg against the knee of the bent leg, and push that knee of the painful leg down. If you get a sharp pain in that muscle, that usually is considered a positive piriformis sign. And the treatment is going to be simply getting into that position again and letting it and stretching gently into the pain. But it's hard to self-diagnose a piriformis syndrome. You're going to need to see either a physical therapist with some orthopedic training or an orthopedic physician.
If you have a question or comment, you can ask it using the Q&A button in the app, which also allows you to send your question anonymously if you so choose. Or you can ask your question live by raising your hand. To do so, click the raise hand button or press *9 if you're on the phone. I will call on you and then you'll be able to unmute and ask your question. And our next question.
I'm sorry. I see a question from Elizabeth Rash here that I want to get to.
That was going to be my next.
Pulling a muscle for stretching seems counterintuitive. It certainly does. The reason is if you have spasticity in that muscle, then cooling the muscle will slightly slow down the stretch reflex. A spasticity is an abnormal stretch reflex. So cooling will very often result in a dampening of that reflex. So it does seem, you're right that it seems counterintuitive. Normally you want a muscle to be warmed up as much as possible. But MS is a disease of great variability, as I'm sure you all know. So the cooling in this case is actually going to make the muscle a little bit less spastic, transiently, not full time, but it will allow you to stretch the muscle out more.
And we can go ahead and answer her other question as well.
Sure. And I use alternative methods of building my endurance. For example, elliptical training to follow your intermittent walking program. It's way too hot in Florida. It sure is. So the intermittent program is going to work on any activity that you want. If you want to build up your endurance, build up your cardiovascular endurance or your cardiovascular fitness, intermittent walking is an excellent way to do it, or intermittent biking or intermittent elliptical. Anything where you will do a period of work that elevates your heart rate slightly, and then give yourself a moment to recover is going to allow you to build up more aerobic fitness than if you exercise without a break. This is just the truth of multiple sclerosis. The more rests you take, the greater amount of exercise you can perform. The greater amount of exercise you perform, the more fit you can become. So the elliptical will work great, but so will a stationary bike, anything. The limitation of a elliptical trainer is it's not exactly the same as walking. So you will certainly build your endurance. You will certainly build your cardiovascular fitness, but it will not be quite the same as practicing walking. If you want to get good at something, You have to practice doing that thing that you want to get good at. And elliptical training is similar to walking in that it uses a bilateral symmetrical pattern. You use both your legs, but it's lacking, it's lacking the picking your foot up and putting it down. But it is certainly much, much better than not walking at all. 1,000 times better.
All right, we have an anonymous question here. I do physical therapy exercise, but my walking is still not good. Any suggestions to help?
Well, without knowing what type of walking you're doing, what type of physical therapy you're doing, it's hard to say. Those of you who've heard my talks before know that I believe the best way to improve walking is to practice lots of walking. And the best way to do that is to practice intermittent or interval walking, where instead of walking as long as you can without a break, do short, fast, high-level walks, but for maybe 15 or 20 or 30 seconds at a time, and then sit down and recover for a minute or two. The primary problem with almost all people with MS is fatigue. The first few minutes or even seconds of an exercise or a movement may go well, but after that period of time, the fatigue starts to take over and the person is unable to exercise at its high level. So to address that, I ask MS patients to exercise until they feel the very beginnings of fatigue, and then I ask them to take a break, recover, and then get back to work.
All right, our next question comes from Leslie. Is water aqua aerobics good for MS?
Are water aerobics good for MS? It depends on what we mean by good. Are they going to help in some way? Absolutely. You'll be able to perform some type of physical activity, which is going to be helpful on many levels, but and you will feel better. You'll burn calories. You'll get cardiovascular fitness. You'll get muscle growth. You will, and you'll be able to do it, assuming it's a cool enough pool, you'll be able to do it in such a way so that you will be able to exercise for longer because of the cooling, and it'll be safe because the water will offer buoyancy. The limitation of aqua aerobics is that it's not going to carry over directly into functional tasks. So I have patients who do a great deal of water aerobics or aqua aerobics, and they get fitter, they get stronger, but it doesn't help their walking that much.
Just a reminder for our audience, if you have a question or comment, you can ask it using the Q&A button in the app, which also allows you to send your question anonymously if you so choose. Or you can ask your question live by raising your hand. To do so, click the raise hand button or press *9 if you're on the phone. I will call on you and then you'll be able to unmute and ask your question. And we have a question from Facebook. Sean asks, I have MS. My legs are severely affected. My friend had a stroke and her complaints are just like mine. Would these exercises help her too?
Yes and no. The stroke and MS are similar in that similar portions of the brain can be affected. One of the big differences, though, is that in MS, you have the problem of thermosensitivity, that your body, the hotter it gets, the more severe your symptoms will become. That won't happen in stroke. So persons with MS have to exercise somewhat differently than persons with stroke. They need to pay attention to the temperature and make sure that they don't over fatigue themselves. Generally, though, the exercises are pretty similar. When I work with a stroke patient, I do very similar things to when I work with an MS patient. I try to see what they're having difficulty with doing, and then I try to come up with an exercise program that specifically addresses that difficulty. So the short answer is yes, the exercises are similar and they would help. The longer answer is it's really going to depend on what exactly the person with the stroke is having trouble with and what exactly the person with MS is having trouble with.
Our next question is anonymous. How many minutes of recumbent biking could be beneficial daily or weekly?
Again, it depends. There's no one best exercise. There's no one best exercise program because everybody with MS presents differently. On a very basic level, it's suggested that people try to do 20 minutes 3 times a week. For some people with MS, that may be too much. What I recommend is to see how far you can go every other day so you get a chance to rest, and don't go continuously. Try to do a minute on, then rest for a minute. Minute on, minute off, minute on, minute off. If you can get up to 20 minutes 3 times a week with that, you're going to be doing very well.
All right. Elizabeth, you have a question.
Okay, can you hear me?
I sure
We can
can.
hear you.
Okay, so I'm pretty active and I keep trying to add plyometrics like broad jumps and hops and things like that. But every time I do, even though I concentrate on a soft landing, I exacerbate my spasticity. Does that mean plyometrics are out, or is there a way I can incorporate?
I'm glad you're doing plyometrics. That's a great thing. The problem for somebody with spasticity in plyometrics is this. Spasticity is triggered by a quick stretch of your muscle. And plyometrics is the ultimate quick stretch of your muscle. So it's going to be hard to do plyometrics if you already have spasticity. Since I have you on the line, one of my questions is, do you take any medications for your spasticity? Like
I
baclofen?
do. I take baclofen.
May I ask how much you take?
I'm taking, let's see, 25 milligrams per day.
So if you're still having spasticity with stretching, you may want to speak to your neurologist about going up on the dosage. Because
I could, but I'm reluctant. I prefer not doing that, but yeah, I understand.
I completely understand that, but it's going to be hard to think of it as an experiment. Try taking more and see if it'll allow you to exercise more aggressively. What I've found is that many people with MS, they have to play around with their dosages to get the optimal level of relief from the spasticity. I know some patients I've known have taken way too much and they have to go down on their backbone, and some take way too little and they have to go up. So it may be worth it for you to experiment a little bit. Speak to your neurologist about going up a small amount and seeing if that will allow you to exercise more aggressively. I think it's worth investigating because I believe very strongly that the harder you exercise, given that your MS will allow you to do so, the harder you exercise, the better an outcome you're going to have. But
So my question would be, once I go up on the baclofen, will I always stay at that dose or have to keep increasing? I know it's a medical question, or can I reduce it with time?
What some people do is they play with it over the course of the day. So for example, some people may take more baclofen during the day when they're around and they need to move around a lot more, and then decrease the dosage at nighttime when it's not as big a deal. So as to whether it'll be at that level, I honestly can't say. But I think a lot of people with MS get a little bit reluctant to use what the medications can offer them. And if the medications do result in better physical function, it's always worth looking at. If you have to go up on the medication to keep doing the things that you want to do and engage in plyometrics or jumping activities or anything, I think the advantage that you get from the jumping activities would certainly outweigh any limitations imposed by the use of that medication.
Thank you so much for your replies, really, seriously.
My pleasure. Thank you for calling in.
Yes, thank you, Elizabeth, and have a pleasant day. Our next question comes from Anonymous. I have severe osteoporosis in both knees and balance issues. What exercises therapy would be good for me?
Okay. Actually, it's osteoarthritis, not osteoporosis.
Osteoarthritis, my bad.
Osteoarthritis, yeah. What exercises would be good? So firstly, if you have arthritis, the most important thing is to keep moving. Osteoarthritis loves it if you don't move. And the more you move, the more mobility you can regain or retain. Not moving is going to make it harder for your legs to move. So you have this double whammy, it looks like, of both osteoarthritis and multiple sclerosis. The best thing you could do for both is to move your legs, move your body. So walking, stationary bike, elliptical trainer, it will have a better result with your osteoarthritis than if you don't move them. One thing you may want to consider, though, is to engage in relatively low impact movements. So no hard dancing, maybe walking in a pool would be a good idea, elliptical trainer instead of walking or biking, but anything where there's a lot of impact will put more stress on your osteoarthritic joints.
All right, we have another question from Facebook. Carrie asks, I use a walker, legs a week. I'm doing stationary bike for 5 to 6 times a week for around 13 minutes a day to help leg strength. Is it better to concentrate on walking slowly to use proper form or just walking more?
I don't think it has to be one or the other for walking. Without knowing too much about you, except from the last sentence or two, what I would say is do multiple short walks with good form, recover in between. So the most important thing is volume, or the dosage, or the amount of time you spend walking, but I don't want you walking with terrible form, just grinding it through. So doing lots of shorter walks where you try to have the best form you can and recovering between each walk by sitting down for a minute or two or more.
Let me take this moment to remind our audience that if you have a question or comment, you can ask it using the Q&A button in the app, which also allows you to send your question anonymously if you choose. Or you can ask your question live by raising your hand. To do so, click the raise hand button or press *9 if you're on the phone. I will call on you and then you'll be able to unmute and ask your question. And our next question comes from Anonymous. How important is it that your PT understands MS? It doesn't seem there are a lot of PTs that specialize in treating people who have MS.
So firstly, it is of tremendous importance. Think of it this way. All of you with MS, you go to doctors who hopefully have some specialization in MS, that they're neurologists or physiatrists who have a lot of training in MS. You wouldn't go to a dentist for your MS. You wouldn't go to a dermatologist for MS. You go to a physician who knows MS. You want the same thing with a physical therapist. There's no excuse, in my opinion, for a therapist not knowing at least the basics of how to treat MS. There's a lot of information. I've put a lot of information out online, and I'm more than happy for any physical therapist to call me, contact me at any time to discuss their patients with. I don't charge a nickel for it. I have multiple tapes out there through MedBridge and other organizations that shows how to treat MS. There's no reason that if a therapist doesn't know how to treat MS that they can't learn. The information is there. So if your therapist does not know about MS and they don't seem to be willing to know, then it's time to find, in my opinion, to find a new MS. You wouldn't stay with a doctor who doesn't know how to treat you, and you shouldn't stay with a physical therapist who doesn't know either. I'll also go out and say, if you're having trouble finding one near where you live, I'm very comfortable with people contacting me by email. Let me know where you live and I'll try to find somebody for you. The people are out there. It's just a question of having to find them. So my email, you can get it through the Multiple Sclerosis Foundation, but I'll say it right now. It's Herb Karp, HERBKARP, PT, like physical therapist, at gmail.com. herbcarppt@gmail.com.
Before we move on to the next question, let me sort of follow up with you on that. What should our audience members be looking for in a PT?
I think the first thing you should ask is, have you worked with patients with multiple sclerosis? When? How many? What is your background in MS? If they give an answer like, all patients are the same, then you should not be seeing that therapist. If they give an answer like saying, don't worry, I'll figure it out as I go, don't see that therapist. If they say, I'm not sure what to do, and you say, well, I can get you in touch with someone who can help you, and they're willing to do that, then that's a good idea. But if they don't have a background in MS, or at least in neurologic disease, then it's probably not a good idea to see them.
Our next question comes from Anonymous. Stairs are difficult for me. Is there any suggestions on the best exercises that would help more? My physical therapist has me doing some leg stretching while sitting.
Well, if the only thing your therapist is doing to help you with the stairs is having you sit down and stretch, I think we have a problem here. Sitting down and stretching is going to get you really good at sitting down and stretching. It's not going to get you good at going up and down stairs. So again, without seeing why you're having the difficulty, it's hard to say, but if one of my patients says they're having difficulty on the stairs, my first approach would be to figure out why you're having difficulty, and I would get you to the stairs and try to figure out, is it a problem of strength? Is it a problem of muscle tightness? Is it a problem of uncoordination? One thing that I do with patients who have difficulty on the stairs is I start with really small stairs. A typical stair is about 8 inches tall, and that may be too hard for many patients to do. So I'll have them work on a really small stair, like a 2-inch stair or a 4-inch stair. Once they can if they can do well on that, I'll slowly increase the height of the stairs. The other thing I'll have them do is to get their body used to the motion of climbing stairs, is I'll have them stand with 1 foot on the top stair and 1 foot on the bottom stair and just shift their weight back and forth so they get the flexibility for stairs in that way. So you may need stretching, but stretching by itself is not going to be enough.
While we wait for additional questions, could you talk a little bit about the value of exercise just in general?
Absolutely. So it's very interesting, but not too long ago, about 35 years, a lot of physicians would tell their MS patients to not exercise because it was thought that it would result in a worsening of the disease, that it would lead to an exacerbation. And that idea was researched, and it was found out to not be true at all, that there was no reason to think that exercise would lead to an exacerbation. And actually, it was found that persons with MS who exercise respond in the same way that persons without MS get when they exercise. So if the person with MS is weak and they do strengthening exercises, they'll get stronger. If they're tight and they do stretching exercises, they'll get looser. So, but there's even better news, and that is that persons with MS who exercise have a less severe type of MS than those who do not. When they've done post-mortem analyses on persons with MS who've exercised chronically, meaning they exercise 2 to 3 times a week for 15 to 20 minutes, though the exercisers had much less evidence of disease than those who did not exercise. So exercise can actually be a disease modifying therapy.
Very good. Our next question is from Anonymous. How do you use a cane on steps?
Okay, well, once again, like most of the other questions I'm getting today, it depends. But let me try to answer it as best I can. First, you have to make sure you're holding the cane in your stronger side. So if the MS has made your left leg weak, you're going to hold the cane in your right hand. Okay? Then you're going to put your right leg on the step first. Okay? And now your leg is on, and so now you have your stronger leg on the first step, and the cane is on your cane, and your other leg are on the floor. Then you bring your weaker leg up, and then you bring the cane up. So it's going to be strong leg, weak leg, cane. When going down, it's going to be slightly different. You're going to put the cane down first, then the weak leg, then the strong leg.
We have a follow-up question. How do you know it's time for a rollator or walker?
Rollator. A rollator
Okay.
walker is a four-wheel walker with brakes. A walker is usually just a front-wheel walker. Sometimes there's no wheels at all. It's going to depend on a lot of people. A lot of my patients do not like transferring to a rollator because they think it makes them seem more disabled. But a lot of these persons find out when they start using a rollator, they can walk much longer distances than if they use a cane. Okay? On the other hand, I try to avoid having patients go to a rollator unless it's absolutely necessary, because it is, as some of my patients have told me, a one-way trip. Once you transition to a walker or a rollator, you don't go back to a cane or crutches. So if a patient of mine is saying that, I first want to make sure that they can't improve their walking without using a rollator by doing some type of exercise or switching to a different cane, or maybe using crutches instead of a cane. So my goal is to always have patients ambulating at as high a level as possible for as long as possible. If the way to do that is with a rollator or a walker, then that's what I recommend. But don't assume that if you're having trouble, you must go to a rollator or walker. It could just be you need to change your exercise program so that you can make better use of the cane.
We have another question from Anonymous. When I walk downstairs, my leg is not stable and it becomes wobbly, and I have to use handrails. Any exercises that can help stabilize my leg?
Absolutely. So it's a very common complaint that my patients tell me about, is they feel less stable walking downstairs than upstairs. And the simplest exercise to do is to practice just standing in a downstairs position. What does that mean? So you stand with one on the steps facing downstairs. One leg is on the ground in front of you. The other leg is on the step behind you. So you're sort of frozen walking downstairs, and you hold that position as best you can without holding on, or with a minimal assist, for about 30 seconds at a time. And then you switch legs. You step down with the other leg. So if you started before with your right leg on the step in front of you and your left leg on the step behind you, you hold that for a few seconds, and then you switch legs. You put your left leg on the step in front of you and your right leg on the step behind you. And you just hold that position for 20 to 30 seconds. Do that a couple times a day.
Just like to take the moment to remind our audience that if you have a question or comment, you can ask it using the Q&A button in the app, which allows you to send your question anonymously if you so choose. Or you can ask your question live by raising your hand. To do so, click the raise hand button or press *9 if you're on the phone. I will call on you, and then you will be able to unmute to ask your question. And our next question comes from Anonymous. if you have problems mentally with going down an escalator, can anything be done for that issue?
So what I'm assuming you're referring to is there is anxiety associated with going down an escalator, and I know that in a lot of people, both with and without MS. Probably the thing that's helped my patients the most is to not look at the escalator when you're going down, but look at a spot in the distance. So say you can see, some non-moving spot at the bottom of the escalator, a piece of the floor or a piece of the wall, and just focus your eyes on that while you're going down. A lot of my patients have told me that this is that has really helped them with the anxiety. Looking at the continually moving stairs of an escalator tends to worsen the anxiety.
I have a question from Doris from Facebook. I alternate depending on my setting. I like trekking poles. What are the best uses for trekking poles?
Trekking poles are great. It's been for many of my patients, it's really changed their lives. Trekking poles make sure that first you have support on both sides, but it also improves your posture. Instead of with a walker or crutches, you tend to be bent over. Using trekking poles keeps you more upright. So using trekking poles is a excellent way of, if you want to avoid going to crutches or a walker, but you feel like a cane is not enough for you, using trekking poles is an excellent way to do it. It's helped many of my patients. The most important thing, though, is to make sure that you're using the correct sequencing with the poles, and you're making sure your posture is very good while you're using the poles. But there's a lot of good evidence that trekking poles are a useful thing for people with MS.
We have a question from Doris. Doris, can you hear us? Doris, are you there? Doris, can you hear us?
I had to unmute. I apologize.
That's all right.
And
Hello,
I think
Doris, ask your question.
I think I just heard part of the question, but I guess if I wanted to elaborate on the trekking pole, I was using or have used it as an alternative to a cane. I want to further advance my walking, and I was curious about feedback relative to using 2 trekking poles versus using 1 as opposed to a cane.
I think you're probably better off using 2 trekking poles, as it'll keep your body more even. The problem with using 1 trekking pole is it kind of pushes you away from the side of the trekking pole. Using 2 trekking poles is going to keep you much more symmetrical. So you're using both sides of your body equally. You'll probably find out that once you get used to using 2 poles, you'll be able to walk much longer distances.
Awesome.
Thank you, Doris.
Thank you very much.
Enjoy your day. Our next question is one that's actually quite dear to my heart. How do you keep from Tracy, how do you keep yourself interested in exercising?
Well, how do you keep yourself interested? I guess the way that I look at exercise for people with MS is I look at it as medicine. All of you, I imagine, or most of you, if not all of you, are taking some medications for your MS, probably some disease-modifying therapy, Copaxone or Rebif, Avonex, Betaseron, Tisabri, Ocrevus, Cellcept. And you take these medicines because you have good confidence that taking these medicines is going to have a very specific impact on your disease, and not taking the medicines is going to result in a worse outcome. So you have to think of exercise the same way. You have to think of exercise as this medicine that you take to improve your MS symptoms. If you don't do the exercise, your MS is going to have a bigger impact on your life. If you do the exercise, the MS will have less of an impact on your life. So how do you motivate yourself? I mean, for some patients, it's they want to make sure that they can do the things they want to do and exercise the way of doing it. For some, it's the way they keep their weight under control or looking good. For some, it's social. For some, it's a question of finding the exercise that they want, that makes them happy. But to me, it's simply realizing this is what you need to do to keep your MS under control.
We have a question from Terry on Facebook. My weaker side is my left side. I noticed that when I'm going backwards, my left leg becomes straight, but the knee doesn't bend. So I'm trying to stretch and hoping the bike might help it too. It seems like my brain says I can't do it. Any suggestions?
So if I understand you correctly, when you walk backwards, your knee locks and doesn't straighten up. So if that's what you're saying, the first thing I wonder is if you can't bend your knee, even though you try, that may be spasticity. You need to speak to your physician about that because there's medication that you can take for it. And there's medication we discussed a few minutes ago called baclofen.
We have a follow-up question on the trekking poles from Ruth Ann. She asked, you mentioned the correct sequencing when using trekking poles.
Sure.
What is the correct sequencing and how do you determine the length of the poles?
Okay, so the correct sequencing is what's called a reciprocal sequencing or opposite arm to opposite leg. So you can do one of two ways. One is you move your right trekking pole in your left leg and then your left trekking pole in your right leg, or you could do it all simultaneously. Move the trekking pole, right trekking pole in your left leg at the same time, and the left trekking pole in the right leg at the same time. For height, you should be able to, the trekking pole should be tall enough so that you can hold the trekking pole by the top with about a 25 to 30 degree bend in your elbow.
We have a question from Anonymous. What is the best mobility device for unstable ground such as sand or dirt?
Oof. The best for unstable ground? Well, I guess it's going to depend. It would be whatever device makes you feel the most stable. Generally, walkers are not good because all four sides have to be there at once. Usually a single cane is what I recommend. If that's not enough, a second cane, but I don't like using two canes on unstable land because if you lose your balance, you have to throw away one of the canes. But it's going to depend on the type of land you're walking on and what device you're already using. When patients of mine go from walking on stable conditions to unstable conditions, for example, when some of my patients visit a place where there's cobblestones, I advise them to use a cane if they're not using one already, so that the instability of the ground is not as much of a factor.
We have another question from Anonymous. If I sit for 2 or 3 hours, when I get up, my legs don't want to move and are stiff. Are there
Right.
exercises for helping this?
Absolutely. This is a very common complaint I get, specifically also from patients who drive a lot. And so what I recommend is this. If you're going to be sitting for 3 to 4 hours, firstly, that's a long time, 2 to 3 hours. That's a long time to sit. So the first thing I would say is try not to sit that long. In my classes, I tell my students to get up at least every half hour just to straighten their legs out. So first of all, if you don't have to sit for 2 to 3 hours at a time, don't. set yourself a timer to get up every half hour, to stand up and let your legs, straighten out for a while. Another thing you can do is, if you're going to be getting up and you've been sitting for a while and you're worried that your legs are going to be tight, you should do something to loosen your legs up before you get up. So this can just be pumping your ankles up and down, moving your knees up and down and side to side, bending forward and bending back in the chair, twisting your trunk. But if you don't move for several hours, your body is going to be stiffer when you get up. So try to do as much movement as you can while you're sitting, and better still, try to intersperse your sitting with periods of standing.
We have another question from Anonymous. Your thoughts on the psionic neurosleeve,
Sure.
FES?
Yeah. A couple of my patients use it. In terms of, does it do what it says it's supposed to do? It absolutely does. Does it stimulate weak muscles to contract at the right time? It does. What you have to understand with that, though, is that it's not a panacea. A patient of mine who's using it right now, it is helping him walk. It's helping him get more, have his leg exert more strength when he's walking. The problem is he's having trouble with other muscles in his body, which the psionic neurosleeve is not impacting. He's also having trouble with his sensation and his coordination, which the psionic sleeve is not addressing. So the salespeople at Psionic, and I hope I'm not insulting anyone, will often make it look like this sleeve is really going to, do a big deal for you. And it usually does result in an improvement, but it only addresses one of the problems. Okay, so persons with MS, when they can't walk, it's usually never for one reason. It's for a combination of reasons: weakness, spasticity, loss of range of motion, loss of sensation, loss of coordination, loss of motor control. The psionic is going to address one of those things, but not all of them. So is it useful? Yes, I believe it is. Is it going to change the game? No, but it will make you walk a little bit better.
All right. Our last question comes from Facebook. Leon asks, how do you know what stage that you are in with MS?
I'm not sure what you mean by stage, like how severe, or is it relapsing, remitting, primary progressive, chronic progressive? Those are questions that are usually answered by your neurologist. If you have a disease course that is getting better and then gets worse and then gets better and then gets worse, then that's probably relapsing, remitting. If there aren't any periods of improvement, then you probably have a progressive course of disease. In terms of how severe is the disease, physicians will usually grade your severity of your MS on something called the EDSS, which stands for the Expanded Disability Status Scale, which goes from 0, which is asymptomatic, to 10, which is the worst you could possibly be. But there's specific tests to get graded at a particular level.
Actually, it looks like we got time for just one last question.
Sure.
This one's from Anonymous. What if you do better with a walker outside and using a cane make me shaky?
If a walker works better for you outside than a cane, then you should use the walker, absolutely.
All right. That brings us to the end of our time. If you missed any part of this conference, it has been recorded and will be available through the MS Focus Facebook and YouTube channels. Reply to your registration email for information on how to access recordings, or sign up for our newsletter to learn about upcoming events. Our next teleconference will be on June 8th at 7 p.m. It will be presented by Dr. William L. Kant, and the subject will be Pride Month, providing better care to the to LGBTQ plus patients with MS. As you leave the conference today, a survey will appear on your screen. We ask you to please take a moment to give us your feedback on this program and your suggestions for future topics, so we can be sure to provide you with the best programs possible. I want to extend our sincere thanks to our attendees for your participation, and especially to Dr. Herb Karpatkin. Please, thank you so much for the time you spent to prepare and share this information with us.
Thank you for the opportunity. And let me say again, I'm happy to take emails from people if you have further questions. herbcarppt@gmail.com. I'll speak to your therapist. So when it comes to MS and exercise, I'll speak to anyone.
And I'd like to extend to everybody listening a pleasant day.